the computer. Okay. Well, good morning, everyone. My name is Aisha Dixon. I'm the director of the Emeriti Retiree Relations Center at UCLA. And we're always grateful to have these presentations from our colleagues across the campus and across different programs and resources that we use. So I'll let Maria introduce our guest speaker today. And in the chat, you have the option to ask questions. We'll likely open it up for Q&A at the end of the program. We are recording this, so I'll be able to update it and upload it later to our YouTube channel in case you ever want to go back and rewatch some of our past presentations. They're all being uploaded to YouTube. So I'll put my information and our department's information in the chat and also our YouTube channel. And with that, Maria, please go ahead and turn it over to our introduction.
Okay, thank you, Aisha. Good morning, everyone, again, and welcome. Thank you for participating. We're so glad to be together, even in this Zoom fashion. Today, we are very pleased to have with us Parisa Sadoughi. I think I pronounced that correctly, and I believe, Parisa, correct me if I'm wrong, you prefer to go by Parisa, correct?
Yeah, that's correct.
So Parisa is pain medicine and anesthesiology certified. She received her training at USC and has been practicing at UCLA ever since. She practices multidisciplinary pain management by utilizing not only procedures and medications, but other specialties to help improve patients' pain. She's a strong believer of physical therapy and prevention to avoid damage to our bodies. The topic of her presentation today is pain management, more specifically low back pain, prevention and treatment. And she has an emphasis on, as I said, low back pain, and will also touch on addiction. So we're very glad to have you here with us, Parisa, and please join me in welcoming Parisa to our presentation. Whenever
Thank you,
you're ready.
everyone. Yeah, so I'm Parisa Sadoughi. I work in the Encino Pain Clinic. Actually, we just opened my clinic there. I was in Westwood, but then we transferred to Encino. I just want to, most of my slides are pretty short. I tend to talk a lot. So if there's ever any questions, I'm not quite sure. How do you guys do the questions on the Zoom meetings and presentations?
We normally ask to be in the chat so we don't interrupt the speaker, but it's up to you. If you want to take questions as they come in, we can have people unmute themselves or raise their hand, whichever you feel comfortable with.
Okay. So the objective of today's topic, today's presentation is basically learn what low back pain is, understand the most common causes of low back pain, and then learn to distinguish between nerve and muscle pain, and then the treatment, of course. So as we all probably know, low back pain is the leading cause of disability worldwide. And it's actually the most common cause of job-related disability. About 80% of Americans will experience low back pain in their lifetime. Most low back pain is the result of an injury, such as muscle sprain or strain due to some bad movement or lifting heavy things. And actually, very few back pain is due to a pathological cause, like, for example, a fracture or a cancer, mass, anything like that. Okay, so origin of pain, we have a few. There's swelling, there's muscle pain, there's bone pain, and there's nerve pain. When I say swelling, it's basically like if you have some sort of inflammation in an area, muscle, or wherever it is, or just maybe, you know, there is some sort of inflammatory thing going on in our body. That's what's causing it. Muscle pain is actually the most common cause of low back pain, and it's due to either strain or or sprain of the back muscle or ligament. And then the back, usually muscle pain is where the pain basically starts throughout the back. You know, you get some presentations where you say like the pain starts here and it goes all the way down, or it starts in the back and it goes all the way up. That's usually muscle pain. There isn't really a bone that way or a nerve that would be causing that type of presentation. And that muscle pain usually comes with it's tender when you touch it. You usually wake up with the pain comes and goes. Bone pain is arthritis of the spine joint. It could be the SI joint, which is the two dimples in our bodies. And usually with movement is when it hurts. So extension and flexion forward and backward, it usually hurts. It's a deep achy pain. Usually it's chronic and it occurs in the 50s. Now, when we say arthritis pain, it's basically osteoarthritis of the low back. And sometimes arthritis pain can lead to something more, like a spinal cord stenosis. So the spinal cord is the nerve, all the nerves that go up and down the spine. And if you have a lot of arthritis, what happens is you get little bone spurs that start producing. So you get overgrowth of the bone, and that can pinch on the main main nerves that are going down, or on the nerves that are coming out of the spinal cord. And you hear a lot of us always say, oh, degenerative disc disease. That's pretty much like arthritis. Arthropathy, spondylosis. There's many names that we use for this. Of course, they are referring to different parts of the bone area, but pretty much all of it is due to wear and tear. Nerve pain is the one that probably is the most troublesome and the most critical one that we have to be aware of, and it usually radiates. So people always say sciatic pain, that's actually nerve pain. So sciatic pain is the last few nerves that join of the lumbar spine that join and go down the leg, which is the sciatic pain. And the other nerves could be like, shoulder pain going down the arm, that's a nerve pain. Or let's say you have this burning sensation, that's usually nerve pain. Nerve pain is the one that doesn't have as easy of a treatment, because we may need a little bit of an extra push from the pain doctor to help with the symptoms. Okay, so what are the common mistakes that we make that may cause low back pain? Is we may lift heavy objects, which is probably the biggest thing. We're not lifting appropriately. So we always hear, oh, don't use your back, use your legs. And that's easier said than done. So a lot of times we kind of are like in a hurry, we're not thinking, we just kind of pick it up like this, and that could hurt our back. Especially as we get older, there's a lot less reserve in our spine, if it makes sense. We don't have as much muscle mass that keeps the bones very secure and safe, so we end up causing ourselves issues. Posture. We are getting younger and younger these days with having low back pain or mid back pain or shoulder blade pain. There's these little spots right by the shoulder blades that we always have issues with, and I think it's just posture. I'm doing it right now. I do it often. I'm trying to sit straight, but we are doing this. Phones, iPads, computers, everything has become so computerized that we're not doing it right. So simple things that we can do is make sure if you have your phone, you lift it up and look at it rather than looking down on it. I try to make mental note of it. Okay, I can't be doing this all the time. I got to sit up, because that can cause a lot of neck issues, a lot of problems with in the neck issues slowly over time. You can pinch on the nerves, and then you end up in a place where you may need surgery, or you may need an epidural or something else. So we have to be very careful and aware of our posture at all times. Now, when I say posture, it's not really healthy to be forcing ourselves to be sitting up and everything, because that can even irritate us more. When we fix posture, it's when we fix the nerves and the muscles where they are actually constantly in a contraction mode without us being aware of it. So normally I would be sitting like this by getting my back muscle strong. Exercises that can do that are things that work on the lats. So these kind of exercises and pulling down. I often, in the middle of the day, just remember, oh my God, I've been sitting like this. So I just do a roll on my shoulder just to remind myself that that's what I should be doing. And that actually has really helped me. Now, my posture is horrible, especially recently, but I'm trying to get back to it. So I think it's never too late. I'm just trying to say, basically. The other thing is poor walking. When I say poor walking, it doesn't mean not walking or walking too much, but it's when let's say I have a little pain in my left knee. And I try to avoid that left knee, and I'm walking more on the right side. So I'm walking wobbling a little bit, or I'm not using both sides appropriately. That actually can make something worse, either your back worse, your legs worse, something, hip pain. But a lot of back issues actually come from people that may have been avoiding a certain position or not walking appropriately the way that we're supposed to. I always say you always should watch kids when they run or walk, that's how we're supposed to run and walk. So just watch them. It's really intriguing how they're such great posture, and the way that they do things is so appropriate. But over time, we just kind of mess up our bodies and the way we do things. Another thing is poor sleep hygiene. And so I know I keep beating myself up, but I think that's the way I have been able to understand it is, my pillow recently has not been really firm. So I've been like kind of sleeping in a weird position with my neck, and I've been having a lot more issues with my shoulders because my neck is not supported at night. I tend to like wake up with like already a little cramp in my neck, and that's because I'm not doing the right thing. And then people who have back pain, actually, it's very important, hip pain, it's very important for us to put a pillow in between your thighs so that your legs are not kind of coming together and putting pressure on the back. So you're supposed to sort of be in the same way that if you were standing, you should be laying on the side. So it should be spread apart a little bit rather than being stuck together. So those are just a few things that we can adjust in our everyday life, and hopefully will prevent and maybe improve our back pain. Other causes of back pain that really there isn't much related to the back is pregnancy, endometriosis, ovarian cysts, uterine fibroids. So all these can actually feel like they're back pain, but they're really not. And then cancer. So if people have leukemia or anything that may, God forbid, has spread there, it may not actually be the back pain, but it's the cancer or other causes. So risk factor for back pain. One is age. Usually our back pain patients are around 30 and 40. The most common is around 50, but 30 and 40 we start seeing it. Of course, recently I've been seeing a lot younger just because, like I said, it's our poor habitus, it's our poor way of living. We're sitting a lot more. We're not as active. Mobility is so important for all of us. Thoracic mobility, which is the mid-back and low back, we're not doing as much anymore. Before we used to walk everywhere. We used to, if you had to go read up on something, you had to actually go to the bookstore. Like, there's an example, you had to go to the library, read a book, and then you'd have to walk out. But nowadays, everything is online. So we sit, and that's the worst thing we could do for ourselves. The other thing, like I said, is lack of exercise. And so we have to really be starting to take a conscious, I know pain actually stops us from working out. So we do have to get the pain controlled enough if we do have low back pain. But if you don't, get moving, mobility, stretches. The more mobile and stretches we do, the better it is for us. They say yoga, but truly, if you haven't done yoga all your life, please don't start doing yoga, because that's when I get a lot of my patients come in at an older age when they just started to do yoga. Excess weight. It makes sense that the more weight you put on something. So our lumbar spine has a curve to it, right? And so that last section gets all the pressure. It's right before the hips start. So the more weight we have, the more weight goes on that little tiny area. And that can actually cause a lot of issues with low back. So we have to try to be conscious of, okay, if I have extra weight, I need to lose the weight. If I told you how many of my patients, after they lose weight, they don't need me anymore without doing anything else, it's unbelievable. So just by losing the weight, we tend to decrease our back pain. So diseases is another one. So if you have a history of arthritis, you pretty much can't do much about it. I mean, you can help decrease the progression, but if you're going to get arthritis, you will get it. It's just a matter of improving the symptoms, making the muscle strong enough to avoid using the bone as much. So arthritis is wear and tear. So the less we use and rub the bones against each other, the better it is with the low back pain and prevention of low back pain. Improper lifting, we talked about. Psychological conditions, actually, depression has been linked a lot with having sort of low back pain, whether it's, a lack of mobility, I'm not sure, or if it's just, the depression causes weight gain, all of that. But psychological conditions have actually shown to be associated with low back pain. Smoking actually increases the chance of low back pain because not only does it decrease the blood flow to the spine, which actually can increase the chance of osteoporosis, which is basically when your bones are not strong enough, they're kind of empty. And then the other reason is because when you smoke, you cough, and you can cause problems with your back, like herniated disc. It can rupture. It can actually cause you nerve issues when the disc goes into it. And so you have to just, if you are a smoker, just be aware of it. Actually, coughing causes risk factors as we get older too. So that's another reason we should all quit smoking. All right, so osteoporosis, I kind of went over it, but it's when your bones are brittle and they're kind of empty, so they're not as strong. To avoid getting osteoporosis, again, there's a genetic component to it, but to avoid it, exercise and staying active is probably the best treatment. And make sure you take your calcium and vitamin D supplements. And it is a main cause of fracture in spine and hips for patients who have osteoporosis. Treatment of low back pain. I don't know if you guys can tell, but physical therapy is probably very important. Physical therapy, physical therapy, physical therapy. It's the #1 solution to every pain that comes through my clinic, because so no matter what I do, at the end of the day, if patients do not do physical therapy, you have to come back to me very often to get whatever treatment we have or procedure that we do. The purpose of physical therapy is to improve posture, improve the way we walk, improve the way we move, and decrease the chances of the bone rubbing against each other or pinching on the nerve. So again, muscles, I think of it as a cushion. They cushion the bone, and so they keep it very tight. There's not as much impact, because if you have good muscle strength, then you're not using the bone as much. So physical therapy is very important in treatment of any pain, especially low back pain. But it's very important to have a good physical therapist. My rule of thumb is if you go to a physical therapist 3 times and you barely see any response, probably not a good physical therapist. Or your problem is just very bad that you're not going to get improvement with physical therapy. But again, I would try to find a good physical therapist. If you ever had physical therapy and didn't see much result, I would try another physical therapist just to see. But physical therapy is very important. And again, so these are basically the chronic treatments, or treatments of chronic pain. We have first tier, second tier, and advanced therapy, and I'll go over it. So first tier, first line treatment is anti-inflammatories if you can take them. So ibuprofen, Aleve, Celebrex, or Celecoxib, and naproxen, Aleve, and meloxicam, which is Molbix. So we can use any of these to help with the pain if you are okay to take them. So some people that cannot take them are people with kidney disease, people who may have a lot of stomach problems, gastritis or stomach bleeding. Definitely you cannot take it. And then they say older age, it can increase your chance of heart issues. And so those are the things that we have to consider when you want to start these medications. Tylenol is another one. It's pretty safe. If your liver is damaged, then probably you shouldn't be taking it. But Tylenol is another medication, and actually the two together work the best. If you have any sort of pain and you can take both, I suggest always my patients take both of them. It doesn't have to be at the same time, but during the day, kind of you can change between the two or take them at the same time, and they work much better. Then topical creams, actually, I never underestimate topical creams. And the topical creams actually include anything topical, so ice, heat. And then the creams, Salon Pause patches, they have lidocaine as well as the menthol. They have Voltaren or diclofenac gel, which actually works pretty well for smaller areas. Usually low back pain, it may not get to the area that you want it to. It works really great for hands, neck, but it can help the low back too, especially if somebody's very skinny. And then CBD oil is another one that a lot of my patients have been using. And then TENS unit. So what TENS unit is it's called, it's basically an electric sort of stimulation we put on. It comes with 2 leads or 4 leads, and the 2 leads you just put them right across where the pain area is, and then 4 you do 2 and 2. They go diagonal. And what it is basically has a little electrical signal. It distracts you from actually feeling the pain. It works pretty well when it's on for non-nerve pain. When it's nerve pain, it might irritate it more. But I really like TENS unit. Again, you have to be using it at all times, or during the time that you're using it is when you get pain relief. So I like it for people who may want to go for a walk or active. I think it's a good idea. Second tier treatment is the medications that we usually basically prescribed during our pain visits if they have tried the first stuff and it didn't work, which is the neuropathic meds, so gabapentin, pregabalin, which is also Lyrica. And there's many other ones, but those are the two most common ones that we use. And, you know, it comes with its side effects. So neuropathic meds usually are actually antidepressants or anti-seizures. So especially the anti-seizure ones, if you think about it, the reason we get chronic pain or chronic pain causes it, which one's a chicken or egg, we can argue, I guess, about that. But the way it works is you get all these signals that go through, right? Because you get pain, signals keep going. It says, oh my God, I'm inflamed, I have a lot of pain. So what happens is anti-seizure medications calm down every signal there is, which includes our brain signals. It's temporary, of course, no real damage will happen. But when people start it, sometimes they get very sleepy, they're very slow. And so that might be the reason that you feel that way when you start these, but over time, your body kind of adjusts to it. But they work pretty well for pain. And then the other ones are amitriptyline or triptyline and duloxetine, which are antidepressants, and they do come with its side effects, but they also work very well for chronic pain. Then there's the opioids, which we'll talk about, but as we all know, it's a pandemic, and so we are very careful with giving these medications to patients because they have seen that not only do they make pain worse in the long run, they actually don't really improve pain in the long term. So they've done a study on people who were on it for a very long time and they came off of it, and basically their pain score did not change after they came off of it. So that's something to kind of take in consideration. But at the time, they do feel like they're doing better. And the reason, I'll go over it, but short term, it's okay. Long term, the reason that we don't want to use them long term is because you feel tolerance. So the amount that used to work is no longer working for you. So you have to keep going higher and higher. And there's a place where you're not going to get any higher and nobody will prescribe it because of all the horrible side effects. Then there is dependence, which means that your body depends on it. It's not really addiction. It's because your body has been, not the two are kind of in the same category, but pretty much the difference is dependence. It's not a psychological dependence, more like your body really needs it. And then addiction, which is a psychological dependence on it, where you like the feeling of them. And then there's the side effects, which are not very good to live with. So short-term side effects of opioids is euphoria, which you feel high sometimes. Only some people do, some people don't. The pain relief, drowsiness, and sedation. And those are the two last ones are the ones that we really worry about because there's a lot of people that end up taking it, they don't realize, and then they're not breathing as well, and then their family members find them not responsive. So if anybody that you know is taking these medications in a high dose, or they're taking them with things like Xanax, make sure that they have naloxone at home in case somebody, your loved one or themselves are taking it and they're not responsive. We want to always have that around. And actually, it's a nasal one that we can use, and it's been prescribed pretty much by most of my colleagues when we do see that a patient may be on a higher dose or taking combination. And not only for their safety, but let's say the kids or whoever's in the house that may take them accidentally. Long-term side effects of opioids, we have nausea and vomiting, abdominal distension and bloating. So gastroparesis is actually real, and it has been associated with opiates. Liver damage, constipation, memory issues, and hyperalgesia. So that's the one that makes me the most worried because I see it so much during anesthesia and as well as chronic pain is when the pain medications actually tell your body that you are getting. So our bodies normally release endorphins, and that's why when we hit something after a little bit of time, we forget about it, and it's not as painful, right? I'm not talking about that initial. I'm talking about over a day or so. But that's because your own body actually releases endorphins, and it basically calms down the sensation of the pain. What happens is when you give it to our body with medications, our bodies stop producing it, and so we think that's the reason that a lot of people have issues when they go on opiates for a very long time with pain. Basically they get pain with just normal touches, which is not normal. And actually fibromyalgia, there is some sort of there's a lot of studies, but there may be a component of the person not producing their own endorphins. And that's where they get pain everywhere. The last thing that we would do is procedures. So epidurals is for nerves. So epidurals, what we do is we go near the nerve that's painful in the back, and usually it goes down the leg, that pain, and we put steroids in it with some numbing medicine, and it usually helps, but it's temporary fix, usually unless it was a one-time incident. But if it's a chronic pain that you've been dealing with, the epidurals will just help it for a short time, and hopefully that will help you to sort of go to physical therapy, strengthen your body, start working out, maybe losing weight if that's an issue too. And then radiofrequency ablation or burning is another one that we burn the little tiny nerves, but this is not the big nerves that go down the legs. Usually these are just the spine nerves that tells us it's a sensory nerve. It tells us our low back hurts. So what we do is we numb it first, and then if it works, then we burn it, and it always regrows. But the whole purpose is that we stop the sensation of the low back pain. We don't actually fix the problem. And joint injections. Facets are basically the joints between the spinal bones, so vertebral bones. So between the two, there's always a little cartilage, and sometimes that with wear and tear, it's not as cushioned, and so you end up getting pain. So you can actually inject that with steroids as well. And then the last thing is spinal cord stimulator, and then of course surgery, but pain management doesn't do that. Spinal cord stimulators are basically these two electrodes that go in the spine, and they send signals to each other, and that is supposed to decrease your pain that you feel in your back or in your legs. It can be used for anywhere, like neck and everything too, but we're talking about low back pain. So that's pretty much it. I talked fast. Any questions that you may have?
There's a few in the chat, Maria, if you want to, there's a couple in there. I can start the first one. So if Voltaren is an NSAID and you're told to avoid NSAIDs, am I saying that right? Should you avoid Voltaren? Is arnica gel useful?
No, it depends on what the case is. So the absorption of NSAIDs is very, very, very little through the topical, which is the Voltaren. So pretty much most of my patients that even have kidney disease, even end-stage renal disease, I don't think there's any problem with using the NSAIDs. If a doctor tells you to even avoid the topical NSAIDs, that's a different story, but that would be very rare because we don't really have that much of it absorbed through our system for it to affect us. Trying to get to the chat, sorry. Okay, here we go.
Did that answer it for you, Nancy? Hang on, I think you have to unmute yourself. Let me.
Well, the packaging on Voltaren says don't use for more than 3 weeks. So, you know, I guess you have to be a little careful with it. What about arnica gel?
Oh yeah, I forgot about arnica. It's wonderful. I should add that to my presentation. It works great. Everybody's very different, Nancy. So some people it works great. Arnica may work really well. Some people CBD oil may work really well, and some people it may not. So I fully encourage you to try the arnica cream, see if it works.
Okay. The next question is from Angie about Copa Iba. I don't know how to say that. Am I saying that right?
Oh, oil? Angie, I've never heard of it. What is that?
Angie, can you unmute and maybe tell us a little bit more about it?
Copaiba oil. I've been told that has qualities like CBD, but doesn't have the negative effects of CBD.
Oh,
so it's an
I'm going to look
oil.
into it. I've never even heard of it. Thanks for teaching me. I know magnesium I really like to take by mouth, but so it's a topical or is it a like edible thing?
If it's pure, well, doTERRA sells it, and their brand is pure enough that you can take it, you can ingest it. They recommend ingestion, infusion, and topical.
I just looked it up. Interesting. I'm going to look into this. I've never even heard of it. I've never even had a patient tell me about it. So, and that's usually very rare because I learn a lot from my patients. Thank you for that. Yeah, I've never heard of it.
Okay.
I'm sort of like in between the Eastern and Western medicine stuff. And so I do believe in a lot of these holistic things. But this one, like I said, I haven't heard of. I mean, a lot of times I encourage my patients to like the turmeric, and actually if they can make it themselves, you know, put it in the oven and basically grind it, and then alpha lipoic acid. And then, you know, there's a few other things for anxiety that helps, but this one's a new one. Thank you.
Okay. The next
other problems. I'm reading other problems such as hyperactivity with chronic use of over-the-counter. Not that we have talked about. I don't. So I think it's kind of a hard one to really do. So the reason I'm saying so is because I'm thinking about it. I think over time, when you use anything, it becomes less effective. But hyperalgesia, I haven't heard of. Now, the question is, after using it for a very long time, and if you stop, are you going to have a lot of pain? And it's possible, but hyperalgesia has not been shown with these yet, at least according to researchers that I have read. The only thing is that it may become less effective over time, and that's definitely true. And now, whether it becomes less effective or it's the fact that, you know, your problem has gotten worse, I don't know which one, but I could say it becoming less effective. But hyperalgesia, I haven't heard about. And then Linda asked, have you been having laser therapy with laser MD pain relief? Very well research meditate office Santa Monica. Sorry, enough that is covered. So I actually did laser therapy myself. I thought it was all, you know, not real, but it does work. I agree with you. The problem with laser therapy is it depends on where you want to do it. So have you been doing it for low back? Because I haven't heard of it being used for low back as much. Linda, I don't know if you can hear me. Also trigger point injections that you, yeah.
I've had dramatic approval with the acupuncture and trigger point injections over at UCLA EastWest Medicine, and Dr. Harold Kraft with the laser. And the best part about him, if you write to him, he'll send you all his research. Super, super solid. If Medicare doesn't pay for something that isn't evidence-based.
So you tried the laser therapy for your low back?
Yes, he does it for everything. And it's basically, the research shows that it stimulates the regrowth of stem cells. But he will tell you when you come in that it doesn't work for everybody. You know, that some people a lot, some people it works little. I can tell you that right now I'm not going because of COVID, and I'm back to like how I was 2 years ago. When I was regularly between going to EastWest and doing the trigger points, and don't everybody call them because they're busy already, but they're fabulous. Everybody over at UCLA EastWest Medicine.
Yeah, actually, I do trigger point injections too, but EastWest Medicine is wonderful. You're going to the Thousand Oaks one, or are you doing the one at Santa Monica?
Santa Monica, and then Laser MD Pain Relief is their website for Dr. Kraft, and they have offices in Santa Monica, Sherman Oaks, and Manhattan Beach. And
so
it was actually
laser therapy
who referred me to them for diabetic neuropathy, but to be honest, it didn't work for that, and he told me it probably wouldn't, and the solution to that is alpha lipoic acid. So
yeah, alpha lipoic acid works really well actually. So the laser therapy, from what I have researched, so the fact that it stimulates stem cell, it's not completely shown yet. So, but I do know that it works really for muscle issues. Right. For nerves, it hasn't shown as much, but definitely must.
I'll send you his research, or if you give me, if I have your email, I can forward it. I've had several.
Yeah, definitely. Also,
I've had several doctors look at it. And again, Medicare doesn't pay for something if it's not. They wouldn't pay for our blood sugar sensors for a long time because there wasn't enough research.
So I just sent you my email on the thing, so you can definitely. I'm more than happy to see that. I'm very curious, because from what I knew, it wasn't. But I'm surprised it's covered. That's good. From what I know, it doesn't stimulate stem cells. I mean, they say may, but it hasn't been proven. But definitely, I'm curious to read it. When to apply heat and when to apply cold for pain relief? Okay, this is a really good question. Supposedly, heat works for any sort of muscle issue and cold works for nerve issue. But My personal experience, it depends on the person. So let's say you've tried heat and it doesn't work, try cold. Cold and it doesn't work, try heat. But they say anything acute, you want to use cold. Anything not acute, you want to use hot. And usually neuro things are more of a long-term thing. So that's what they suggest. But again, everybody's different. What kind of a CBD would work best, and what is the best use against? What's the best to use against muscle pain? And I have a question via audio. Okay, Carmen, do you want to just talk about it so that it'll be easier?
Okay, here I am. Yeah. I just experienced something odd. I had my first vaccine shot last Saturday, and I could feel how it was moving from my left arm into my neck, and I've had a stiff neck since then. It's gotten a little bit better, but obviously it had something to do also then with my posture, because I was trying to avoid certain moves or whatever. And now, since yesterday, I have this acute pain in my upper left leg, and it sounds from your description that it might be a muscle thing, because it's when I'm step, I can feel that it pushes against something and it hurts. So I'm wondering, is it something that is hopefully just temporary and all of this is linked? Or, I mean, it's just a very weird thing. And should I
just get the vaccine again? 1 week?
Last Saturday. So barely a week.
So it's probably the vaccine. There has been a lot of data about, so my own personal experience with the vaccine, I've been having pain and it started a few days after actually. It's getting better, but I definitely still have it and it's like a month after, but it does get better. COVID versus knee pain, outside knee pain, but yes, most likely it is. But what I would suggest is, are you able to take any anti-inflammatory medications?
No, I'm allergic to aspirin, so I could take Tylenol.
Estoy escuchando una.
Sorry?
It's okay. It was someone just talking, but I muted them. Go ahead.
Okay.
So what I would do is I would do the Tylenol. And okay, so CBD, which one works? I've heard so many different ones out there. Apparently it's like, I've never been to it, but apparently there's supermarkets of CBD stuff. So it's like, 1-to-2 ratio, 2-to-3 ratio, all those like different ways. One of the ones that I've been told by a lot of my patients, but this is before CBD became so common, is Val's marijuana cream. And it's not CBD, it's actually marijuana cream, but you can find it online. A few of my patients said it was really good. But I would probably, for your pain, I would try to do the Tylenol. I would just do a little bit of a massage wherever the pain is a lot, if you have someone that's with you, with a little bit of, so warm it up, massage it after warming it up to kind of get whatever's going on. Maybe it will help decrease whatever that tension is that you've been feeling. No shoulder pain though, right? It's the neck mostly.
Yeah.
Okay. And then the other thing there's muscle relaxants, but I'm not quite sure if they work for everybody.
No.
I'm
not a friend of
I'm sure. The other thing you may want to do is actually the topical Voltaren gel that we talked about. That one you should be okay to take NSAID. What kind of allergy? Is it aspirin only or it's all NSAIDs you have allergy to?
I'm not sure. I've been avoiding anything that contains any sort of aspirin.
Because I wonder most of the time, what happened when you took aspirin? And was it a long time ago?
I've had 2 incidents and I end up in the emergency immediately. My whole body swells and my face particularly. So
that's the real allergy. Let's not deal with that.
Yeah.
Do the Salonpas menthol or lidocaine patch and put it on the neck for now. So you could do the heat before, don't put it on there. And then for your, and you said it's behind the leg that you've been having some issues with?
It's at the side, and in certain positions it doesn't hurt at all, but when I get up and I step, it pushes against something and it's a very acute pain there. So I wouldn't want to go for a walk right now, let's put it this way. But when I
And
sit,
it's in the lower leg, or is it the foot?
it's the upper leg. It's at the side. It's
Oh,
just
you might have a greater trochanter. Can you look up greater trochanter bursitis and do the test to see if that's what you have? It sounds like that's what it is. So, oh, sorry, I'm sending that to not everybody. Let me, how do I, okay. Let me send it to everyone so that everybody can see it. Greater trochanter bursitis. Check this out and see what you think. And then my email, I just realized I sent it privately. So I'm going to send it to whoever. I think it's Linda.
and what,
okay. Oh.
And what would help against that, if that's what it is?
So look it up. Look up what it is. Do the exam to see if that's what you have. So basically, it's right outside the hip area. You press on it and it hurts. If that's the case, you may have either the burst starving or the fascia. That's the issue. So if that's the case, you can get like one of these ball rollers and roll it on the area to help kind of do it. And there's these exercises. You can Google everything nowadays. So Google the exam to see if you have it, and then Google exercises or stretches and see if it helps.
Right.
If it doesn't help, you can do an injection, but I'm pretty sure if it's something this acute, you can get it to be better.
Okay, thank you very much. Yeah, sounds great.
Of course. And then there was, okay.
I think
so
the next
Linda,
one was from Carmen or Linda. Linda was the next.
So I want to answer Linda. Linda, I think already kind of, I think Linda had said something about this time. So I'm going to talk about Linda. So trigger point injection, just for everybody, it's basically these like little injections we do with a needle. It's not, they say it's not the medicine that we put in there, it's the needling. So we go back and forth and kind of open up that spasm or whatever it is. And it works great temporarily for muscle spasms. So just so that and then, so I think Linda, and then Angie, I think responded to the CBD, right? The total brand.
That's the
yes.
brand.
I think the next one was Carmen about EastWest medicine with Kaiser.
Why don't you do this, Carmen? I love EastWest medicine. I don't know. Does anybody know the answer to that?
We had an EastWest medicine presentation a few months ago. And I know it's through UCLA. You would have to probably see what's similar through Kaiser's. Kaiser's they're in their own bubble.
Yeah, selective. So yeah.
You would probably want to call Kaiser and see if, unless you get like some sort of referral, they might not let you do something at the UCLA EastWest medicine, but they might have something very similar through Kaiser. Does that answer it for you, Carmen?
Yeah.
Yeah, otherwise I would not be able to enroll by myself with EastWest. I mean,
Sure, if you want to pay them.
Yeah, if you want to probably pay out of pocket, you want to probably go through Kaiser. If you have Kaiser, see if they'll give you a referral. And they might do that if they have a specialist that they don't have a Kaiser, but you would need to go through Kaiser to find out more.
Okay. All
right. Carmen, I think you might want to consider doing the cash only, because from what I know, they have a really good cash only price. Because I know when I talked to Dr. Todd in Thousand Oaks, he was saying that they work a lot with the patients to make sure they can afford it, because a lot of it is not covered, or it wasn't at the time, covered by insurance. So I would actually call the EastWest Medicine Clinic. Okay. Let me see if I can find their number for you. I would definitely call them and just see what the prices are if you're going to do cash only. I do love them. I think they're wonderful. And honestly, they're just they have such great bedside manner too. I don't think I've ever had a patient that's been unhappy with them. So I'm writing you down the number. Okay. And then you can just try to see. It's worth a try, I think. Sometimes with the insurance, it might end up being more of a hassle than just going cash, and it might be pretty affordable from what I remember. Oh, somebody else. Linda already wrote it. Look at that. Linda, you beat me to it. Linda, I sent the email right before. Did you get it? You said did not get email. It's under, here, let me write it again.
Oh, I got it.
Oh, you got it. Okay, perfect. Okay, Kathy, that's a very good question. Did I miss anything? No, Liz, I'm sorry. So Liz is next. So neuropathy, it's actually one of my favorite things to treat. depends on what kind of neuropathy. Do you want to explain a little bit? Do you feel comfortable telling me what kind of neuropathy you're talking about? Is it diabetic neuropathy? Do you have some sort of like a nerve damage? What's the reason? If you're still on.
Go ahead, Liz, you're unmuted. Hi.
Hi.
I can't hear you though. Do you have a microphone?
Yes, it's nerve. I've been to 3 neurologists and they've told me they just give up. They've given me 5 different medications. None of them work. And they can't, and they also did that muscle check where they can't figure out the reason either.
Where is your neuropathy?
Feet.
Feet, okay. So feet are the difficult one. And is it both feet?
Sorry?
Is it both feet?
Yes.
Okay, so there is a few things I'll write down for you. These are mostly experimental. Did you ever try ketamine compound cream?
Sorry, say that again.
Ketamine compound cream.
No, I've never heard of it.
Okay, so I'll write you the concentration.
Ketamine.
And then you can maybe ask your primary or the neurologist to see. You can try it. I can't promise anything, but I think it's worth a try. So that's one thing you can try. And I'm assuming you've tried the typical Cymbalta, Lyrica, gabapentin.
Every single one of them. No, they didn't.
Okay.
None of them.
So the other thing that we talked about, are you taking supplements like alpha lipoic acid?
What kind of supplement?
I just wrote it down for you. Alpha lipoic acid. You might want to start.
Alpha.
And then the last thing is you might want to consider low dose naltrexone. This is totally experimental. The medication is not experimental, but it's experimental to treat neuropathy. So those are the things that I would suggest you think about and you may want to consider.
Thank you very much.
And Kathy brought up a really good point. I'm assuming the neurologists have checked vitamin B12 deficiency, right? And folic acid and everything you've tried.
Yes.
Okay. Does taking doses greater than recommended daily amount help, or is that toxic? So Kathy, from what I understand, the only 2 vitamins you can become toxic in, because everything else is water soluble, you can just pee it out, is vitamin D and vitamin E. These 2 are the ones that I think are not water soluble, so you can't just pee it out. So those are the 2 that I think you can become toxic in. I think everything else, you just pee it out. And I think that's it. Any other questions?
Let me double check. Okay, I think it's just about the replying heat and the brand. Okay, does anyone else have a question? I think we'll just open it up to asking questions. Feel free to unmute yourself or type it in the chat. It's good to see some familiar faces. Okay, I'll ask maybe another time in case if anyone does have a question. Otherwise, we can probably end today's session. Any other final questions? Quiet group. Is it raining everywhere? I think it just started pouring down in the valley. So
I have one final question. I didn't quite get your comments about CBD creams. I wondered if you could repeat that, what you would recommend for CBD creams.
I don't really have a certain recommendation because there's so many that I would just be doing it. I wouldn't be just, it would be justice to kind of say one. But I had experience before it became so common. I had a few patients of mine that were using Valve CBD cream or marijuana cream, and they were very happy with it. But from my experience with CBD, you have to have a component of marijuana for it to really be effective. We were going to actually do a study at UCLA, but it didn't work out. But I think no matter what, I mean, you know, it doesn't have to be a huge portion of it, but maybe a 5-to-1 or 3-to-1 ratio of CBD to marijuana for cream. I don't encourage ingestion, but the cream, there shouldn't be much of like an ingestion of it or anything like that when you put it on body.
Okay. I think one final question is to avoid neuropathy. Any suggestions?
Okay, don't become diabetic. So, you know, definitely try to decrease any sort of chances of your sugars being high. That's one thing. So a lot of times we don't really know why people have it. I can tell you I've had a few cases that we try everything and there's no response. But diabetes is probably one of the most common reasons for the neuropathy, especially in the feet. Another thing is chemo radiation. And so people who get chemo radiation, they may end up with that neuropathy in their feet. But the best thing to do is just have a very healthy diet. I always say, you know, prevention of everything is the best. And so you bring a really good point. So try to have a good, healthy diet with a lot of vegetables. I really think that makes a huge difference in our lives. And then, you know, make sure that you are getting enough vitamin D because vitamin D, a lot of us are lacking vitamin D in our diet. So not diet, I should say, in our daily life, which includes the sun and going out, just all stuck in the house. So if you don't take a supplement for vitamin D, I would probably start taking it unless you're very active outdoor. And that's pretty much the only thing you can really do for prevention. The other thing is make sure you can get neuropathy in the feet from the back. So make sure, you know, we talked about all this stuff, posture, you know, making sure you're got good like strength in the back and everything else. Okay, does acupuncture work well? Yes and no. So I have had so many different responses with acupuncture with my patients. I think one of the reasons is it depends who's doing the acupuncture. So, you know, some acupuncturists are wonderful. They really know what they're doing, and some may not be as great. But acupuncture helps with everything, I think. I haven't really had anybody say it hasn't helped them if they go to a good person. And so, yes, acupuncture does help, but of course, I don't think it helps when you have a real like pathological, maybe it does help, but like, you know, if you have a fracture or if you have, God forbid, cancer, then it may not be as effective. Any other questions, anyone?
I think,
I have one.
I heard someone.
I've had sciatic pain, and I've heard other people talk about sciatica. Other than posture, avoiding car accidents, are there things that we can do to protect against that?
Yeah, and so protect or treat, which one are we talking about, or both?
Sciatica pain?
Yeah, protect or treat. So protection, like we talked about, it's basically to have a good strength, posture, avoid heavy things. But for treatment, there's a lot of stuff we can do. We can do daily exercises, which really help. So whenever we get a nerve problem, what happens is the nerve travels through all these muscles, right? So as it travels and as it innervates, it's going through those muscles that end up becoming very tense because they're uncomfortable. So by being tense, what it does is it presses on the nerve even further. So then it sort of goes in a cycle. So the nerve irritates the muscle pinches more on the nerve, and then the nerve becomes more irritated and makes the muscle even more spastic. So what we need to do is fix the path of the nerve. So help to decrease that spasm that's happening with the muscle, and then get to the problem too. So I would encourage, if you have a lot of muscle like tightness or whatever, you got to stretch those out when you have sciatic pain, and then, you know, slowly stretch, strengthen, and hopefully it should help. But I can tell you, it's called the double crush injury or something? I can't remember, but usually that's what happens. When you get in one injury, it actually makes another problem happen, and that problem exacerbates the initial injury. So we've got to take care of both in order for us to get better, not just take care of one. So if you do have sciatica, I would really encourage you to try to do passive stretches. So, you know, a foam roller or like a ball, wherever you feel like it's a tight area, I would actually have it kind of open up that area and then stretch your back too. Anything else?
Okay. I think that's it. So thank you so much for your presentation today, Parisa. I put your information, your email in the chat. And again, if anyone has any other questions, I will upload this to our YouTube channel, and I'll put that in the chat too. So if you're, we were having all these presentations on Zoom, so we decided to create a YouTube channel to kind of put all these presentations somewhere. So it's an archive of all of our past presentations this past year, COVID. And as we get new presentations, with the speaker's permission, we'll upload them to YouTube. So have a great weekend, everyone. Stay dry, stay healthy, wash your hands, and we'll see you at the next presentation. So take care.
Thank you, Parisa.
Thank you, everyone.
Thank you.
My pleasure. My
Bye,
pleasure. Take care.
everyone.
Thank you.